Well, a few weeks ago we started and treated our first patients already in the meanwhile, and everything went very well. It was during the holiday season, but okay, the ramp up was the initial ramp up was really good. I'm really happy about it, and yeah, that could only happen with good collaboration with the IBA team. And it is a very complex machine to install, but also to maintain and to set up. And they did a good job and were able to deliver us a very stable system at the moment for these first weeks. We could really rely on the system, and that helps a lot in treating your first patient. That at least you can focus on the patients. We started off with a combination of RayCare and an IBA system, which is, as far as I know, the first time worldwide that happened. And it went okay. We have a good system at the moment. A lot of effort was put in the communication between RayCare, obviously, as an OIS, and the ProteusONE system from IBA in our case. A lot of effort was put into that project, both by IBA and by research. And at the moment we have a good platform to build an efficient workflow in the future, and further develop to tune and tweak the RayCare to our way of working. And this whole team supports us in our effort to treat the patient in the most optimal way.